Hello, everyone. Well, we've been talking about a lot of issues relating to the adults, but today we wanted to focus on the kids, specifically on atopic dermatitis. And with us in our studio, we have Dr. Chetali. She is head of the Department of Ayurvedic Institute in Bangalore, and she heads the Department for Mother and Child. Welcome, Dr. Chetali.
Thank you, Amita. How are you doing?
Good, good, great. Just explain us exactly what atopic dermatitis is, and then we can go into the kids part of it, or do the kids get it?
So, atopic dermatitis is this, I would say, a multifaceted kind of a disorder. It's an inflammatory disorder. That means that it starts out of an inflammation inside our body, and
Mm-hmm.
it ultimately results in atopy, which is a kind of an allergic reaction in the body, which manifests into our skin. So children are more prone to it, especially infants, or it's very common in children before 2 years of age.
Mm-hmm.
But even children under 5 years of age and adults also can have it. Earlier, it was known as eczema, but
Mm-hmm.
because eczema is such a broad term, to specify it more so to pediatric population, it was renamed as atopic dermatitis.
So you said it's very common in the kids. Do they get it? How do they get it? I mean, like, is there bad diet that the kids have, especially at a young age?
Right. I mean, even infants can have it, and their diet is just breast milk, right? So that gives a lot of clue about how children might be getting it.
Yeah.
Currently, worldwide, almost 15 to 20% children can suffer from atopic dermatitis, and almost say 3% to 10% of adults can have it as well. So
Mm-hmm.
in children, there could be multiple cases. For example, it could be genetic. That is, they have a defective gene,
Mm-hmm.
which leads to kind of a defective function of skin, that the skin barrier or the skin's health is affected because of the genetic defect. That could be one reason.
Mm-hmm.
It could be hereditary. For example, if there is history of any atopy, for example, even if you have allergic rhinitis, that is atopy, allergy of a kind. If
Mm-hmm.
you have asthma, if the
Mm-hmm.
mother or the first degree relatives have history of asthma,
Mm-hmm.
that also is atopy, and it can be passed on to children.
Mm-hmm.
Or if you have any other history of any kind of atopy or autoimmune disorders in running in the family, that could be a genetic cause.
Mm-hmm.
Now, we saw a wide jump into incidence of atopic dermatitis after the Industrial Revolution. In the last 4 decades, we have seen a huge jump all over the world in incidence of atopic dermatitis, especially
Mm-hmm.
in industrialized nations.
Yeah.
So that has related to even exposure to certain environmental toxins through our food or water or the air as well.
Mm-hmm.
And then have food allergies also. For example, milk or nuts or fish or mites, with dust mites or pet dander and all sorts of things. So the causes also could be very different for different children.
Sure, sure. And we were talking about it earlier. If the infant has the dermatitis, then it's coming from mother's breast milk, and then the mother
Yes.
will get right the some kind of a medication or whatever you want to call it, right?
Yes, in Ayurveda that we do that. So
Yeah.
it could be like, it's very commonly seen between children who are 3 to 4 months old.
Mhm.
Sorry, 4 weeks is the time when it peaks, and we see it a lot in infants starting at that age, wherein it's just a rash which starts on their cheeks or just on the
Mhm.
neck, or
Mhm.
the flexor surfaces of our body, that is on the elbows or behind the knees,
Mhm.
and it never occupies the diaper area.
Mhm.
So that helps to kind of differentiate it from many other atopic conditions, or
Yeah.
many other skin conditions which may look like it but are not atopic dermatitis. For example, psoriasis. It
Mhm.
looks very similar to atopic dermatitis, but that doesn't affect it. It affects the diaper area, and atopic dermatitis doesn't. Then you have something called as a seborrheic dermatitis, which commonly affects scalp even in adults. It looks very yellowish and crusty and
Mhm.
slightly hypopigmented skin.
Mhm.
But unlike atopic dermatitis, which disturbs sleep in children, like it's very itchy in the night, and the itching is the most prominent symptom,
Mhm.
seborrheic dermatitis doesn't itch in the night. So
I
that's another thing. There are, yeah, certain mite infections may look like it, or certain contact dermatitis cases because of wool or some, metal, which can, even they may look like atopic dermatitis, but it's very important that we differentiate it from other ailments as well.
Sure, sure. So let's talk about Ayurveda now. How Ayurveda helps with it.
Absolutely. So we have a very clear-cut description of atopic dermatitis in our classical textbooks.
Mhm.
And it describes about how we cannot have same approach to different kinds of atopic dermatitis.
Mhm.
Although I do not want to give out a lot of technical jargon, which may not be understanding, which many people may not understand because our
Mhm.
texts are in Sanskrit. I
Yes.
would put it in very simple words. We
Mhm.
differentiate atopic dermatitis in four different types
Mhm.
depending on what energy might be out of balance inside a child's body.
Mhm.
So we try to correct. For example, in conventional medicine, they categorize it as acute, subacute, and chronic
Mhm.
based on at what age you get to see it in children.
Yes.
So if there are a lot of blisters on the skin and if there's a lot of skin cracking, a lot of itching, and it's just a newly occurred atopic dermatitis, say in a few weeks old baby,
Mhm.
then it's acute dermatitis.
Mhm.
According to Ayurveda, it's according to it's categorized into one category, and we give different types of herbs which are mainly cooling and blood purifying herbs,
Mhm.
and we give a specific diet to the mom to follow who's breastfeeding the child.
Yeah.
So it helps. We see it in clinic all the time. Then we have the subacute variant in which there is itching and the child is having it from quite some time. And then we find out certain associations with certain foods or certain irritants which increase the itching. It may increase or decrease according to various seasons
Mhm.
and various triggers.
Mhm.
So that is subacute type in which you see some cracking on the skin. There's a lot of itching and a
Mhm.
lot of skin inflammation that can be seen. So that is the subacute. We ascertain it to another dosha in which we encourage people to moisturize the skin more often and
Mhm.
have foods which are of a particular kind which help to balance those energies. And then we have the chronic one in which the skin becomes thick and leathery. There's a lot
Mhm.
of dark hyperpigmentation which is seen on the skin, and it's
Mhm.
mostly seen in older kids. So we do not have a one size fits approach in Ayurveda towards atopic dermatitis. We take each child as an individual. We will try and understand what has gone out of balance. We pay
Mhm.
a lot of attention to gut health in children because according to Ayurveda, atopic dermatitis is always associated with some imbalance in their stool habits and in their digestion, in their appetite, how they eat, even as babies. So we pay a lot of attention. So we do not have like a fixed set of things that we give each and every child. Sometimes we may even medicate the mom, if she's breastfeeding, instead of
Mhm.
giving medications because it's very difficult to give medications to young babies.
Yes.
And in older children, we'll make sure that the medicines are palatable, they are safe, they do not contain any heavy metals,
Mhm.
and applications and therapies are given along with diet, which helps gut health.
Okay, so let's just talk on a very broader terms. Like, yeah, like you said, it's not one size fits all, and Ayurveda is a very personalized medical
Absolutely.
system. But on a like, let's just talk about from a diet point of view. What are the food groups or what are the dietary guidelines on a very high level that you give to kids who have this issue?
Correct. So if you see common food triggers, whenever we have any kind of allergy in the body of any kind, which we call atopy in medicine. So
Mhm.
whenever we have that, what triggers allergies commonly are all the food groups which have high proteins in them. It may be nuts, or it may be certain meats, or it may be just eggs, which can
Mhm.
trigger a lot of allergy. So we ask the parents based on their food habits and their traditional dietary habits here, at least in India, to avoid certain food groups. For example, to avoid eggs and to avoid particular nuts, for example, cashews and ground nuts, need to
Mhm.
be avoided. It definitely helps the itching to come down. Certain other foods like garbanzo beans or chickpea flour
Mhm.
and foods which are made out of chickpea flour often increase itching in children, and we do see that difference that high protein foods like chickpea flour can trigger itching massively, and so
Mhm.
does cashew and groundnut. So when
Mhm.
you leave out these food groups, there is definitely a 10 to 20% decrease in itching right there and then. Then comes the whole category of dairy. So depending on the child's gut health,
Mhm.
we help them kind of figure out whether the child should leave out dairy products or not. Mind you, this has nothing to do with lactose intolerance. That is not what we are discussing here. We are
Yeah.
just discussing what is a child's digestive response to milk as a
Mhm.
whole in their body. So
Mhm.
that's another thing that we pay attention to.
Mhm.
Other things are including a lot of nutrients which help the gut health. For example, Fermented foods are really good, and we encourage parents to include that in their diet. Say, for example, sourdough bread is a fermented food, and it's excellent for people who are having any issues related to digestion or gut health. That's just an example. Of course, certain kids cannot tolerate a lot of gluten, so many things which are made out of wheat may be also left out of their food to help itching get better. And other protein food groups like meats and fish, that is very specific to certain patients. So we will see what's their response. We will take a lot of feedback. We will ask the parents to maintain a food diary as to what might have increased itching in the child, and try to piece together that information to figure out what could be a better diet to follow for that child, so that at least 40 to 50% of the management is through food.
Yeah. And then herbs, are they safe to give it to the kids like 3-year-old, 4-year-old? Some of the Ayurvedic herbs, or you have to avoid those?
No, they are safe. See, the palatability of Ayurveda medicines, because most of the blood purifying herbs which we give according to Ayurveda in skin related conditions are very bitter in taste. And the taste, the bitter taste, is something which helps the body purify blood better. It works on the liver, it detoxifies the liver, it allows the liver to purify blood better. So many of the herbs are bitter. However, because we have made huge advances in pharmaceutical industry as a whole, you do get syrups and you do get infusions, you do get tinctures, which are very easy to administer in children. So according to the suggestion of your Ayurveda physician or Vaidya whom you are consulting, you can easily figure out what is a safe Ayurveda herb to include for your children. Because not all herbs are allowed in children. So there are certain herbs, for example, we have something like Manjishtha and Sariva. These are Ayurveda herbs, and tincture of turmeric is excellent to boost immune system. So depending on a child's body type and what kind of atopic dermatitis they are experiencing, we can selectively choose certain herbs and include it in their treatment plan.
And so, and what about yoga, like, or breathing techniques? Do you think that also plays a part in this for kids?
Oh, yes, absolutely, yes, because one of the triggers for itching in atopic dermatitis is emotional stress. So
Yeah.
children do experience a lot of itching, especially older children, not younger. Older children, children about 6 or 7 years of age, can experience a lot of itching related to emotional stress. Some of them have separation anxiety that can trigger a lot of itching. So in such children, at their level of reception, certain yoga techniques of abdominal breathing, that is diaphragmatic breathing as we call it, pranayama, which are breathing techniques in yoga, certain balancing postures in yoga, which really allow the brain to cope with stress, are very helpful, and we do advise them for children of particular age groups who are receptive to yoga.
And then, okay, so I think that's great. I mean, getting the kids started with the yoga and pranayama early age, that will help them so much, when as they grow older, right? To manage the stress and anxiety, which is so rampant now. What about panchkarma? Is panchkarma allowed with the kids, or that's a complete no-no?
No, it's not. So what we have is very simple guidelines. So many of the guidelines in Ayurveda were not intended towards fellow practitioners, they were intended towards people. Yeah. So we have very simple guidelines in Ayurveda as to which child can be given panchakarma. Of course, it's not many of the panchakarma are not recommended in very young children. So what does Ayurveda say? Ayurveda says that cleansing techniques, especially those which focus around the gut, should be given to those children who are independent. Independent how so? So they are independent in terms of communicating how they feel verbally or non-verbally. So they are independent that way. And those children who are physically strong to be able to tolerate such therapies, they can be given kind of detoxifying herbs and not necessarily panchakarma. So we can include herbs and Ayurvedic classical combinations which are purely herbal, which help to detoxify their system at a very mild level. Older children who are 9 and above, I would say, who can clearly communicate what they are feeling, can be given several cleansing procedures with the guidance of an expert who knows what he or she is doing.
Yeah. No, I think this is a really good, amazing information. If people have questions, I see people are watching this right now live. If you have any questions, we are talking about atopic dermatitis specifically for kids and how Ayurveda can help using dietary guidelines, herbs, and yoga, and then some panchkarma. And so the idea is to really make all of you understand that Ayurveda can help. that's the focus. Anything else you'd like to add before we wrap up?
What I would say is that no two children with atopic dermatitis will have same experience, depending on their age and depending on what is the energy which has gone out of balance within them. What is their body type, which is Prakriti, which is another very wide concept in Ayurveda and so relevant to health now. So depending on that, they do need a customized solution for their health issues. Then second thing is that it is possible to come out of atopic dermatitis. Yes, it can be very trying on your patients. It can be very trying on your nerves to keep following up and, keep through the therapy. But yeah, am I audible?
Yes, we can hear you. No problem.
Yeah. So, based on that, it is, it can vary from child to child, and it is possible to come out of it with the right kind of Ayurveda medicines and when started as early as possible.
Okay. No, thank you so much. I think Ayurveda is amazing medical science. It is a customized, personalized, and it has this element of personalization that no one body is alike, right? In the sense, like all of
Absolutely.
us are different. And that's the essence of that. If your child is having some gut issues, dermatitis issues, seek out an Ayurveda practitioner in your area. And we are also coming up with programs very soon from Dr. Chetali, which we will keep everyone informed when we come out with that.
Absolutely. Thank you so much for having me today, Amita. It was wonderful.
Yes, thank you so much to all the users. If you have any questions, you're welcome to put it in the chat window. I see people are watching it. If you don't have any questions, I think you got what we're trying to say, but help us give feedback and help us improve ourselves on a daily basis. With that, have a great weekend. Bye-bye now.